World Oral Health Day 2023. The theme for this year is Be Proud of Your Mouth. So on the 20th of March every year, today, we ask the world to unite to help reduce the burden of oral diseases which affect individuals, health systems, and economies everywhere. Now, what is World Oral Health Day's purpose? Well, World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Why is World Oral Health Day important? Well, oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they're often linked to other serious health issues. And yet, there's no reason to suffer. Most oral health conditions are largely preventable and can be treated in their early stages. So with that in mind, I'm going to be talking to an amazing lady today, all the way from the Eastern Cape. And the resume is quite good, man. So talking about Dr. Kakamba Mbali Njotini, also known as Dr. Q, is a general dentist that is currently doing her community service in PE in Gqeberha for the Nelson Mandela Bay Municipality. She is currently a member of the South African Dental Association's Young Dentists Council. She has also recently featured in a career magazine, namely Mzansi Careers with Kanya. Dr. Q's special interests revolve around restoring smiles and oral health, therefore enhancing one's beauty as a whole. She aims to become a health professional that carries the duality of a general dentist and beautician. Dr. Q invests her time serving her community at heart since she is originally from the Eastern Cape. So she spends her time aiding the public sector by attending to patients ranging from all ages in the different townships located in Gqeberha and Njotini. Now, when she's not practicing dentistry, she is at home watching a Pastor Sarah J. Roberts sermon or reading up a psychology-affiliated book. Dr. Q.
Yes.
How are you? That's an interesting bio, man. How are you?
I mean, definitely. I'm listening to it and I'm like, that's actually quite a good bio.
But that's you. That's you. We spoke about you.
Myself. Yes.
So thank you for taking out the time. Young Dentist Council. That's amazing. So you're still young then? I
am definitely still young. I'm still in my prime and you know, ready to face the face of dentistry, definitely.
I love that. All right, so does that kind of give you, do we get to know the real you in that bio? Is there anything else that you maybe want to add?
I think it's definitely said it all.
Okay.
The next thing it would be definitely that I'm just a tooth fairy at heart, aiming to restore people's smiles and make sure that their wishes come through.
I love that.
Yes.
I love that. Before we start, tell us about psychology-affiliated books. Are you kind of studying more details about mental health then, or what is it?
Definitely. I'm currently reading a book of Discovering Emotional Intelligence by Philip Holder. I'm more, interested in, ways to enhance your mental health, your emotional health, and spiritual health just as a whole. Because I think those are the essence of your day-to-day in order to combat day-to-day challenges.
So true. Wow. Not just a doctor, but wanting to kind of make a difference as well. And mental health is so interesting and so diverse, so complex. And yes, getting to know more about it is so important. So I love that. Well done on what you're doing.
Thank you. Thank you so much.
All right. So Dr. Q, can I call you Dr. Q? Is that okay?
Yes, please. Yes.
Where does that nickname come from? Is that a nickname, right?
Dr. Q is definitely a nickname. It's a brand upcoming, definitely. So I like it when someone refers me to as Dr. Q.
All right. I love that. Okay. So Dr. Q, what are the different ways to improve my daily oral health routine? What should I be doing?
Okay. So I usually say to my patients, there's your 5 essentials. And the first I would say definitely is to always consult your dentist every 6 months for a dental cleaning. The importance of dental cleaning is very significant in that you only do maybe a good 60% of cleaning. and the remaining 40 is done by the dentist every 6 months. So I always say, go to your dentist, go and consult, because you never know if you have an underlying gum disease or, a toothache, upcoming. So always go and visit your dentist at least once a year, and at best twice a year. Always make sure you introduce your flossing into your routine. This is just daily, before bedtime, before you brush, and with your flossing, you're definitely optimizing cleaning your in-between areas in your teeth. So always make sure that you're flossing daily. Make sure that you're rinsing after every meal. People don't know this, but it's not only just sweets that cause, your dental cavities. It's also your starchy meals.
Oh, wow.
So yes, definitely your snacks as well, your nuts, your fruits and all sorts. They have a high content of sucrose, and those are the things that cause your cavities. So it is important to rinse with a glass of water after every meal, from breakfast to supper. And definitely another method would be to change your toothbrush every 3 months. I mean, you must just think of your toothbrush as your broom, your mop.
Oh, yes.
You are always mopping the same area. Obviously, it will be collecting a lot of debris. So always make sure that you're changing your toothbrush, and just in general, have a good, healthy diet that contains your healthy snacks in order to decrease the amount of exposure to sucrose and starch. Yes.
Okay, and if I'm suffering from bleeding gums while brushing my teeth, how can I solve that?
I would definitely say what I said in my first point is go consult your dentist, because when it comes to, your bleeding gums, you never really know if it's an internal factor or external factor. If it's an internal factor, you must probably have an underlying, disease manifesting in the oral cavity. If it's an external, factor, it may be your technique, maybe brushing your teeth too hard, and as a result, you remove, the protective layer on your teeth and your gums, causing the sensitivity, causing the inflammation, and causing the bleeding. Or the type of bristles that you brush with. I always promote to my patients soft to medium. Your hard bristle toothbrush usually cause a lot of abrasion and cause, tears, micro tears on your gums, therefore causing it to bleed. And also just the frequency at which you brush your teeth is very important. You need to make sure you are brushing day and night, because, your bacteria manifests at night because you close your mouth. Imagine you've gone your whole day eating whatever you're eating, you didn't brush, you sleep, and you close your mouth. And this is the perfect environment for your bacteria to cultivate and cause cavities. So definitely I would say those could be the leading causes.
Okay, and so I brush my teeth twice a day. What difference will it make using like a floss? Will that help me?
Using floss will definitely help you. I'm going to use an analogy in that, in between your teeth, what we refer to as dentists as an interproximal area is like the corner in your house that you don't usually clean. And as a result, if you don't go there with a dust, a dust feather, your webs start to build up, and you start getting spiders, start getting ants and cockroaches in that corner.
Yes.
So, the interproximal areas in your teeth are that corner in your house. So your floss, as a result, is your feather duster. It goes in between your teeth and under your gum line, where your toothbrush wouldn't be able to reach, and it actually removes your bacteria subgingivally. And as a result, you are able to reach those areas and remove your bacteria effectively. Therefore, 100% cleaning your teeth and your mouth as a whole.
Okay, nice. And if I'm suffering from toothache, but I'm scared to take out my tooth, is a tooth extraction my only option, or are there other options?
Of course not. Tooth extraction usually is the last resort. There's definitely a lot of procedures available for treating dental pain. We treat it. It ranges from your filling, your baseline filling, to your deep filling, to your root canal treatment. And then if we see that the cavity is too extensive and there's too much destruction that's happened, then we resort to a tooth extraction. So I would say tooth extraction is not your only option.
Okay. So if you've just joined us, Stephen Taylor with you on this Monday afternoon. We are chatting to Dr. Q, of course, World Oral Health Day 2023. The theme for this year, be proud of your mouth. Now, Dr. Q, when I drink cold or hot beverages, I suffer from sensitivity. Are there ways to aid with that?
Yes, of course. So definitely you need to understand there are different factors that cause sensitivity, mainly being how abrasively you brush your teeth, age, different genetic factors. But, making sure that you aren't brushing your teeth abrasively, ensuring that when you brush twice, at least once of the 2 times that you brush your teeth, that you leave the toothpaste to actually sit on your teeth. And when I say actually sit on your teeth, in that brush your teeth without rinsing with water. What it does is that it ensures that the fluoride is able to sit on your teeth for longer and actually able to carry out its mechanism of action for longer and able to build the strength of your teeth. Rather compared to if you had to rinse it with water, you dilute your mouth and obviously you rinse out the very important ingredients in the toothpaste. So I always suggest to my patients that have sensitive teeth is that your Sensodyne is your friend because it has specific ingredients to, accommodate tooth sensitivity, but also just to leave their toothpaste for longer on their teeth without rinsing with water. You don't have to do it twice a day, but at least out of the 2 times that you do brush your teeth, do try to practice such.
Okay. And as a new mother, I worry about my baby's oral health a lot because I've seen my sister's children suffer from cavities in the front teeth, even though they didn't eat sweets. How do I prevent that from happening to my child?
So with issues regarding that, it's mainly, it starts from breastfeeding. It's what we classify as early childhood caries. And it's from the moment that the child is breastfed. What mothers really don't conceptualize from the beginning is that from the moment that a tooth comes out of a baby, it needs to be taken care of. It needs to be, taken care of as if you were taking care of your own teeth. So this means that after breastfeeding, you need to make sure that you go in with a gauze or any type of tissue paper and just wipe your baby's teeth before they sleep. Other practices such as your sippy cups, what you put in your sippy cups are very important. You find with your mothers, here where I work in the public sector, they tell me that they put in Fanta, put content such as Coca-Cola, water with sugar. And, you want to cringe at this because it's already, toxic towards an adult. You can only imagine for an infant the level of sugar intake for their teeth. So as a result, cavity forms at the front teeth because a child, will sip on that sippy cup until they fall asleep. Yes. And then, the sugar is there for longer. Therefore, a plaque attack is there for longer and a cavity obviously forms. So I would definitely say practice, putting rather healthy liquids such as water and milk in your sippy cups and just making sure that you supervise your children when they're brushing their teeth from your ages of 5 until upwards and making sure that they use the correct toothpaste, which is your milk teeth toothpaste and not adult toothpaste.
Yes.
Yes.
Okay. So I once went to the dentist with a rotten tooth that was swollen around the gums surrounding the tooth. The dentist prescribed medication for me and asked me to return the week after that. Why is that?
So usually we get these patients that come with a huge swelling and it's probably because the patient, waited, more than the required time to come to the dentist to take out their tooth. And as a result, the infection moves from the tooth into the gums and then into the tissues, the tissue surrounding the gum. And as a result, this could actually be quite fatal. So what we do as a dentist or anyone in that position is that we first treat the infection. We try and, treat the swelling and remove, the source of inflammation. And then after, do we try and remove the tooth. We also try to avoid it in terms of pain, because it's much more painful to remove or extract a very infectious tooth versus a less infectious tooth. So we try to just prescribe antibiotics, your anti-inflammatories, and just ensure that, the swelling and everything goes down. And then after 5 to 7 days, we try and extract the tooth. So I think that is why, they were told to come back a week after.
Okay, so we are talking to Dr. Q. It's all around World Oral Health Day 2023. The theme for this year is Be Proud of Your Mouth. All right, Doctor, you said a bit earlier on about the technique of brushing your teeth. Is there a technique that we should be doing?
There is a specified technique, what we refer as a modified bat technique, and this is basically where you point your toothbrush towards your gum. Most people think that when you're brushing, that your toothbrush bristles need to aim towards, the actual tooth. But the truth is that the places where the bacteria accumulates is by the gum. So you need to ensure that your toothbrush bristles are always looking towards your gum. You always need to make sure that you're going in an orderly sequence. Start from your top left, top left, bottom to the right. Don't go in a disorder, because then you forget a certain section and then you don't go back to it, and then that's where the bacteria starts to accumulate. So make sure that you're brushing all the surfaces from your front teeth to the back to your last molar, because I know most of the extractions that we do, it's back molars, and it's mostly because someone is brushing in a hurry and then they don't get to the back teeth. So make sure that you also include your tongue. Please make sure that you brush your tongue. A lot of people, go in and forget the tongue, and that's where, most of the bacteria sits is in between the papilla of your tongue. So ensure that you brush your tongue, ensure that you are brushing for at least 2 minutes. I always say, if you are able to sing Happy Birthday, the song Happy Birthday in your head, and finish it, that is the optimum time that you should be brushing your teeth, and ensuring, therefore, that you will be cleaning your teeth effectively.
Okay. Okay. And tell me, how important is, you said rinsing your teeth after every meal. How important is using a mouthwash then?
A mouthwash is not as important. I would say if you are suffering from halitosis or suffering from just a huge accumulation of bacterial plaque. If you aren't being attacked by a lot of plaque, then I wouldn't suggest, a mouthwash. Okay. If you do use a mouthwash, just always ensure that it has a lower content of alcohol, because, your alcohol tends to dry up the gums and therefore cause inflammation. And then you don't understand why you're bleeding, but you're using mouthwash, and that's because of the alcohol content. Make sure that it has more fluoride than alcohol, otherwise. Okay.
All right. Any closing thoughts, and how can listeners contact you, Dr. Q?
I am currently a community service dentist, but I do have an Instagram page, which is Dr. _QUE _Njotini, which is NJOTINI. I'm currently, on the way of creating the brand, so I don't have a practice number yet, but it's coming, definitely.
All right, so they can go and follow you on Instagram, Dr. _Q _Njotini.
Yes, sir.
All right. Doctor, thank you for your time. I really do appreciate that. And listen, keep up the good work that you are doing. You're based in Quebec, right?
Yes, sir. That is me.
All right. Not great. Thank you so much for your time. I appreciate it. And yeah, let's all go and do our bit for World Oral Health Day and Oral Health Month. So important.
Yes, please. Thank you so much.
Thank you, Dr. Q. Keep well.
All right.
Thanks.
You too.
Bye-bye. Bye. All right, so today's Oral Health interview is proudly brought to you by SADA, South African Dental Association. Now, SADA's vision is to be recognized as the trusted leader and voice of oral healthcare in Southern Africa. Our mission is to promote the interests and serve the needs of our members, and above all, encourage optimal oral healthcare for all South Africans. Now, learn more about the South African Dental Association by visiting www.sada.com. sada.co.za. Now learn more about the Young Dentists Council, YDC, by visiting www.sada.co.za/young-dentists-council-YDC. www.sada.co.za/young-dentists-council-YDC.